Hello and welcome to this video in our educational series on neurodevelopmental disorders. If a child in your house has ADHD or attention deficit hyperactivity disorder, a neurodevelopmental disorder, as a parent you might have several questions. How to assess the child, how to perceive the symptoms of ADHD in your child. So these are some of the questions we'll address in this set of videos and understand the role of parents in assisting children with ADHD. Come, let us meet our expert.
So ADHD or attention deficit hyperactivity disorder, it is a common neurodevelopmental disorder, and predominantly the symptoms of ADHD are inattentiveness, hyperactivity and impulsivity. But apart from these symptoms, children with ADHD also have other problems, like they have difficulty in organizing, they have difficulty in planning, they have difficulty in self-regulation, that is in terms of emotional regulation and behavioral regulation. And these symptoms can cause a lot of dysfunctionality in multiple domains of a child's life. So most often you will hear parents telling that my child does not listen to me, he is always distracted, he seems to be in his own world, he does not complete his school notes in spite of telling him multiple times, he makes a lot of small careless mistakes, it's because he does not care about it. So a lot of symptoms that is arising out of the core symptoms of ADHD is seen as parents as bad behavior by the parents. Parents many a times are not able to understand that these are actually symptoms of ADHD that is causing difficulties in the child's functioning both at home, in school and also with their peers and others in the community. So if you look at children, naturally children may have less attention span, they will be more active compared to that of adults. So many a times parents do have this question that is my child having ADHD? But how do we really diagnose ADHD? So ADHD, as I mentioned, the core symptoms are inattention, hyperactivity and impulsivity. When inattention becomes a major problem in all facets of their life. It can be in studies, it can be during playtime, it can be during their conversation with someone, or the child is hyperactive to such an extent that they are not able to do things that is expected out of them. For instance, sitting in class through the time that their classmates are able to do, or they land up having frequent fights with their friends who they are not able to take turns during their playtime. So when these symptoms, they become pervasive across multiple domains and it causes dysfunction in the child's development, that is when we have to think that there is a possibility of ADHD and the child needs to be comprehensively assessed by a mental health professional. Okay. First and foremost thing is, when you come to know about that your child has ADHD, first is trying to understand what ADHD is, because when your understanding or your lens changes from an intentional problem behavior to that of a disorder in certain areas of your brain, of the child's brain, it makes you naturally empathetic towards your child and to a great extent reduces the guilt and the self-blame that one poses as a parent. And the second thing is, once you know that there is ADHD, how is this ADHD affecting your child? Because every child is unique and a child with ADHD will also have unique set of problems. For one child it might be hyperactivity and the major concern might be to just calm down the child. For another child it might be inattention and difficulties in concentration, where the management will be little bit different. So once you understand that the child may be having ADHD, it is important to do a comprehensive assessment in terms of medical, educational and psychological evaluation, so that you can understand how to go forward with helping your child. So as mentioned, ADHD can cause a lot of challenges in a child's life. So there needs to be multiple accommodations or modifications in multiple levels of their life to actually assist such children. So it may require assistance at home by parents, they may require additional help by teachers at school, and at a community level with peer interaction or going outside, they may require additional help so that they can have a adequate functioning that is appropriate for their age. So we can address this in detail in the subsequent episodes.
This concludes today's episode, where we tried to understand what is ADHD, what is the role of parents, how parents perceive the symptoms of ADHD, and also understand the possibility of diagnosis of ADHD, and what are the things the parents could do about this. We will be back in the next episode trying to give more details for parents. Namaste.